Hello everyone, hello, this is Heavy to Lightweight, and I am back in the hospital. Let me start from the beginning. Sunday, March 18th at 7 o'clock in the morning, I would say like 6:38 in the morning, I started up throwing blood with blood clots. At 9 a.m., at 9 a.m., my brother again called 911, and the medics rushed me to my local hospital. When I was at the hospital at first, they were saying because I was throwing up for a few weeks now, what happened was the vomiting. From all the vomiting for weeks, it caused my esophagus to have a scratch. So they did another CT scan on my stomach, came out fine. And then he tried to do a stomach tube, also called a nasogastric or NG tube. It's generally about like a half a centimeter in diameter, and it is made of pliable plastic. He's supposed to insert it through my nose, past my pharynx, and through the esophagus and into my stomach. And it's supposed to drain the contents from out of my stomach, which is the blood and blood clots. So after he tried to pass it through my nose, I threw up all over myself because the NG tube hit my lungs and I couldn't breathe. And I vomited again all over like an exorcism. Just vomit, blood clots all over me. So later in the day, my mom came, and she came to the hospital, and she spoke with my surgeon who was in Miami. She called him on her phone. I live like an hour and a half away from Miami, so again, that's why I didn't go to the hospital there, because I was throwing up blood. So I just need to get to the hospital fast, any hospital fast. So when he spoke to her, he said, I need to get the hell up out of there and come to his hospital, because it's a Center of Excellence hospital for bariatric patients. I know. I know that's where I'm supposed to be, in his location at his hospital. But I didn't think it was going to get this serious, especially where I started throwing up blood and blood clots. My last video, I told you guys that I was just throwing up, and I couldn't consume anything, like nothing. Everything that was on my list that I'm supposed to take, from sugar-free Jello to sugar-free 100% apple juice, sugar-free, to sugar-free popsicles, just sugar-free anything, water, vitamins, I kept throwing it up. My mouth is so dry. So my mom told the ER people in my area, the hospital I was at is Weldington Regional Hospital. She told the ER people that we need to be discharged now, because she spoke to my surgeon and he said the vomiting of the blood and blood clots are not due to the surgery. He said that I need to be transferred to his hospital. Oh, excuse me. So my mom, she was talking to people in the hospital, and she was like, give us the release form so we can get the hell up out of here. So we hauled out of the ER after I signed my paper to be released from their care. And we went straight here, Palmetto General Hospital, where I am now, in a safe place, being taken care of. Hold on, I need to wash my mouth out. It's so dry when I talk. Again, I can't have nothing by mouth, but I gurgle water. I do gurgle the water and spit it in the bucket. It helps make my mouth not dry. So, as soon as I got here, they gave me an IV bag that included my multivitamins, minerals, my B12, my thiamine, you name it, it's in there. It's in the bag. Unlike the other hospital, they just gave me a normal IV bag, solution bag. So, the next morning, which is March 19th, I spoke with my surgeon, and he said the reason why I can't consume any of my multivitamins or water or even Jello is because I have anostomatic stricture. So, in anastomosis, for the word anastomatic, it is a surgical connection between, I had to look this up, between two structures. It usually means a connection that is created between tubular structures, such as blood vessels or loops of the intestine. For example, when part of an intestine is surgically removed, the two remaining ends are sewn or stapled together, which is the word anastomist, and the procedure is referred to as an intestinal anastomosis. So that's what anastomosis means. Now, what he diagnosed me with was anastomatic, which is another word for anastomosis, anastomatic stricture. As the anastomosis heals, it forms a scar tissue which naturally tends to shrink or contract over time, making the opening smaller, which in my case happened 5 days after the surgery. This is called stricture. Usually the passage of food through an anastomosis will keep it stretched open, but if the inflammation and healing process outpaces the stretching process, scarring may make the opening so small that even liquids can no longer pass through it, which is happening to me. The solution is a procedure called gastroendoscopy, which is what they're trying to get ready to do. Not right now because it's like 2:41 in the morning on March 20th now. What they're going to try to do is gastroendoscopy and stretching of the connection by inflating a balloon inside my pouch. Sometimes this may have to be performed more than once to achieve lasting correction. So right now they have me hooked up to an anti-inflammatory IV to help promote inflammation, pain, and support the blood clotting function of my platelets, and protecting the lining of my stomach from the damaging effects of acid from me vomiting for over a week. So that's my update. As sad as this may sound, I'm happy to be here in this hospital, getting help rather than at home suffering from vomiting and lack of being able to intake anything into my mouth. Right now, or since I've been here, I'm on fall precaution. Here's my little fall precaution band because I get dizzy when I stand up and I tend to fall. I have my blood transfusion band just in case I need blood, and I am NPO, which is nothing by mouth. I'm also off of my high blood pressure medicine because I am now low blood because of what's going on with me. My pressure goes from normal. My pressure at times when they check it is normal, not high anymore, and then it goes low throughout the day. So that's pretty much it. Yeah, I'm here in the hospital. I've been in and out of the hospital for days, and now I'm in Palmetto General Hospital. I've been here since Sunday morning, and today is now Tuesday morning at 2:44 in the morning. I cannot sleep. Yeah, so that's my update. They're gonna do everything possible to fix it. They said it's fixable. It's not life-threatening, which is good. Just that my pouch went from being, a normal gastric bypass pouch to becoming restricted, and I can't take nothing in. But, they're gonna fix it. Some way, somehow, they're gonna fix it, and I'll be out of here soon. I do know I'll be in here for a couple of more days because they're gonna fix what's going on with me. My mouth gets dry when I talk. Excuse me. So that's my update, and you guys can still comment, email me. I did bring my laptop here because I have way more energy here because they're giving me what I need than at the other hospital or home, because when I'm home I take my medicines and I throw them back up. So I can talk back and forth with anyone who wants to discuss more of what's going on with me, or just to say hi. So everyone have a good morning, because it's in the morning now. And if you wake up and watch this, good morning. If you're watching in the evening, good evening. If you're watching this at night, good night. So I'll talk to you all soon. Peace. And continue to pray for me. Thank you.